Let's talk about vaccinations, because that is where this COVID-19 story is very much heading in Australia as the New South Wales curve finally begins to flatten. Even if health officials don't want to over-egg it yet, New South Wales, which today will be hitting 79% first dose vaccination, could just about get to that 79% level of double dose in 5 weeks, which would allow it to open up even more than it is planning to then, if they had the supply, it seems. Susan Pearce, the New South Wales Health Deputy Secretary, saying this morning that Pfizer appointments still have to be kept at 8 weeks between appointments, up from 3 weeks, until more Pfizer supply happens in October.
The Polish Pfizer blitz that we conducted, as you know, had a longer time interval. That was in order for us to get all of those first doses into as many people as possible at the time, and we succeeded in doing that. What we continued to do during that period, though, was to keep vaccinating everybody who already had a booking. With respect to the UK Pfizer amount and also the Singapore amount, the amounts that we have received so far are not sufficient for us to do all of those second doses yet. So our information from the Commonwealth at the moment is that we can expect to receive more of our share, our per capita share, then broken down into the Health Department share in October, which will allow us to do all of those second doses.
Well, as we know, New South Wales has copped a lot of flack for getting more vaccines than other states while it battled the country's biggest outbreak. Well, while they wait for the Pfizer to fully vaccinate younger people, something the Doherty Institute suggested should be done first to stop transmission, WA has broken the mould. Mark McGowan announcing today that over 60s can now get Pfizer in WA, completely undermining the AstraZeneca vaccine there.
Based on the latest advice from our Chief Health Officer, West Australians aged 60 and older will be eligible to receive a Pfizer COVID-19 vaccine from next week, from 6:30 a.m. Monday, September 20. People in this age group who have not yet received a COVID-19 vaccine will be able to register and book an appointment at a state-run COVID-19 vaccination clinic.
There is a reason McGowan must feel he needs to do this: vaccine hesitancy. In New South Wales, 89% of 60 to 70-year-olds have had a dose of the vaccine. In WA, that figure is just 74%. Roger Cook, McGowan's health minister, even admitting at the press conference the Delta strain is expected to get into WA at some point. The good news nationally is the Pfizer from Britain has been flowing from Friday, and therefore more vaccinations are occurring after a lull, about 20,000 more this Monday than last Monday. We are just getting through this first rollout, but questions remain about the next steps. When will booster shots have to occur? Still no announcement on this from the federal government. If you think about it, Scott Morrison was one of the first to get the jab in February and March. Will he need a booster soon? Will aged care workers vaccinated at the beginning of the year need boosters soon? We know 12 to 16-year-olds are starting to book their first shots. The other question is, will under 12s be vaccinated next year? That looks likely, Kieran.